Hi, and welcome to today's demonstration of the pin and pull stretch of the pectoralis muscle and the latissimus dorsi muscle. Our model today is Rose, and Rose has had quite a lot of trauma to her right shoulder over the last 4 years. She has had 2 surgeries to remove a tumor, and that one of those surgeries became infected, so there was lots of scar tissue. She's also had radiation on this area. Then Rose broke her collarbone, and after that healed, then she broke her humerus. So she's had a lot of trauma to this area in the last 4 years. She has managed to regain most of her range of motion on this shoulder. But there's still some stickiness and a little bit of discomfort in certain positions. So you can see that Rose's right shoulder drops down lower than the left shoulder and is a little more rolled forward. So Rose, if you'll just bring your arm up, you can see that the arm comes up, but then she starts to feel a little pinch right where the supraspinatus tendon is. And does that feel pinchy, Rose?
Yes.
Yes. Okay, so what we're going to do today to help release the pressure on this supraspinatus tendon is we're going to release the latissimus dorsi muscle. So the latissimus dorsi muscle, it takes up a lot of space on the back. It inserts down into low back, into the thoracolumbar fascia. It comes up and then inserts onto the arm bone. So the pin and pull technique on this, if you want to have help from someone, ask them to go in with soft fingers. So they're just going to gently grip the tissue, and it can be quite tender in here. Is that tender, Rose?
No.
No, this is not tender on Rose, but regardless, we want to go in with soft fingers. And now I'm going to hold that latissimus dorsi while Rose raises her arm. So just raising the arm up and turning the hand toward the ceiling. So we're going to open up and just keep on coming up as far as you can. This is creating a stretch on this muscle. It's breaking up fascia and adhesions on this muscle. Can you come up farther, Rose? Okay, and then come back down. And she can just start moving the arm up and down as quickly as she wants, or as slowly. And she can reach out in front of her, come across her body, just moving the arm around in as many directions as possible. And this will affect more fibers. Now, is that quite tender when you come across like that? Yeah. So as she moves her arm and stretches this muscle to its max, and I can feel underneath my fingers that the skin is feeling tighter. And you can feel discomfort with this. You should not feel pain. If you are having trouble lifting up the arm, you can actually take your other arm and grab the wrist and help pull up. And so as she's moving around, I can also be changing my fingertips. And so the more I come up in towards her armpit, the more tender. Is this tender, Rose? Yeah, so she's really feeling this in here now. And if she comes across her body, she'll feel more, and she's really feeling it now. But if she goes back and forth in that direction a few more times, it should start to release and the discomfort will pass, and the shoulder joint will feel like there's more space in there for her to move her arm. And is that happening, Rose? Is that starting to back off and starting to feel better?
Yes.
Okay. And so let's just bring the arm down, and we'll have you face like there. And now lift your arm up again and let us know if you're feeling that pinch in that supraspinatus tendon.
Right there.
Right there. So Rose is still feeling it. Has it lessened at all, Rose?
Yes.
It has lessened. So if Rose continues to practice this particular pin and pull on the lat, Eventually she won't feel that anymore because this lat is binding the shoulder girdle. So the other muscle that Rose feels tightness on is the pectoralis muscle, this big chest muscle. It attaches to the sternum. It also attaches to the collarbone. This is one that you can do on your own body quite easily, but you can also have somebody do it for you. So Rose, what we're going to have you do is take your left hand and just grab your pec muscle. Just pick up the tissue. Yeah, and how does that tender in there?
Yes.
So it's tender, so be gentle with yourself. And now Rose can just start to lift her arm up, and she can bring it back.
Oh, yeah.
And yeah, she's really feeling that. So just keep moving your arm around, Rose, and that will start to back off and loosen up that area. Quite often, if this pec is tight, it can cause compression of the nerves and create numbness and tingling down the arm into the hand. So be gentle with yourself. Work slowly. Practice for a few minutes at a time and do it several times a day. So it's better to do it more frequent, smaller amounts than trying to do a whole bunch at once, because you can actually experience some tenderness after this. So good idea to warm the tissue up. You can use hot compresses, you can do self-massage, you can have a shower, and then after you do the work, same thing again, flush the tissue out. Hot compress, hot shower, self-massage, anything to warm the tissue up. Now Rose, let's just have you bring that arm up one more time. And are you feeling that pinch anymore?
Oh, no.
So we release the latissimus dorsi muscle, this side muscle here. Just lift your arm up, and you can go in and pick up the tissue all the way on the side of this muscle to affect it. And then the second muscle we looked at today was the big pectoralis muscle, and you can just go in and pick it up, and you can work on yourself with this one, or you can have someone help you. Thanks for watching today, and if you want more information, please visit my website, CourtneyMassageTherapy.com. Bye-bye.